will get us set up on Facebook Live. So we'll be simultaneously broadcasting this event on Facebook as we are doing it on Zoom. So I'll just need about a minute or two to get us going there, and then we can get started. All right, Angela, we are ready to go, and I'll turn it over to you.
Right. Thank you, Kelsey. Appreciate that. I'm Angela Champion-Sproul. I'm Director of Development for the School of Public Health and Information Sciences. And I'm here to welcome you again to one of our ongoing series of virtual engagement chats for our alumni and friends, our students. And today we're joined by Dr. Bewley, who will be interviewing our School of Public Health and Information Sciences Alumna of the Year, Dr. Jennifer Forristal. And just so that you know in advance, a question and answer session will follow the interview. You can use your Zoom chat and submit questions throughout the conversation. We'll go to those questions during the Q&A and also refer to some questions that were submitted when people registered for the event. Our interviewer today, Dr. Bewley, is an associate professor in the School of Public Health and Information Sciences. He joined the UofL faculty in 2016 to serve as the first program director for the new Healthcare Leadership undergraduate degree program. And he is currently the director of healthcare management programs for the school. Dr. Bewley is a board certified healthcare executive with the American College of Healthcare Executives. He currently serves as the president of the Kentucky chapter of the American College of Healthcare Executives. He served as a fellow for the Commission on Accreditation of Healthcare Management Programs, and he has served as also, prior to coming to the University of Louisville, 23 years in the Army Medical Department, including combat tours in Iraq, leading combat support hospital. So we're very fortunate to have him as our moderator, and of course fortunate to have our alumna here to hear more about them. And Dr. Bewley can take it from here.
Thank you, Angela. It's a beautiful day here in the Bluegrass State and in the Louisville, Kentucky area. Dr. Jennifer Forristal, how are you? How's your day going so far?
It's great. I'm happy to be here.
Excellent. It's great to have this time to spend with you. How did you feel when you found out that you were selected as the 2020 School of Public Health and Information Sciences Alumnus of the Year?
I was excited. I was humbled. I was proud. I ran, told my husband first thing, and then I just started shooting off texts to pretty much everyone I knew. It was really great.
All right. Well, how did you become interested in the field of public health?
So I was looking for a way to further my career, and pretty much everyone around me was working on an MBA. And I happened to get a card in the mail about the MPH program here at UofL. Population health and the triple aim, now the quadruple aim, we're really starting to gain traction in managed care. And now you're really starting to see the impact of that. Like you have health plans that are focused on addressing things like food deserts and housing issues, things that would historically be outside the scope of healthcare. So pursuing a degree in public health is really a way to differentiate myself. And now public health is really becoming fully integrated into the way that we look at healthcare. So it seems like it's a really good choice.
Absolutely. So can you tell me about your experience at the School of Public Health, and how did that experience aid and develop you in your role?
So my MPH gave me a really broad knowledge base, and then working on my PhD, I was able to really focus in on policy, and that's really helped me in my current role. And just being in the School of Public Health really helped me to have an open mind and look at issues from multiple perspectives, not just from the classes, but interacting with peers that came from all backgrounds and viewpoints. One of my favorite classes was seminar, where we would read a bunch of articles and come together with peers and professors and have a roundtable discussion. And for me, it was just as much about listening and learning from the others as it was about contributing. So I think having a degree in public health has really set me apart in my career because it's still somewhat unique. But I was blessed to be able to work and go to school. So I was able to use what I was learning in the classroom in my job, but then I was also able to take what I knew about things in managed care and contribute to my education. So I think that meshing them together, it's just really helped to escalate my career and where I am today.
Are there any faculty, perhaps a practicum experience or that made a substantial difference to you that you recall from your time as a student?
I mean, Dr. Esterhay and Dr. Wainscott, they've always been great champions of mine. They had, open doors. They would have conversations about anything. I really appreciated the classes that they taught. And then, of course, Dr. Wainscott was the chair, and I think he stayed on a little bit longer than he might have wanted to retire to help see me through. He said, "Now you need to get done," and I did, but he has a special place in my heart.
All right. Well, can you help us understand your role at Optum? What do you do, and how do you create value and serve populations in your day-to-day role as Senior Vice President for Innovative and Strategic Agreements?
So actually, I lead a few different teams. I lead the Formulary Consulting Group. That was a team I started with when I came onto Optum a little over 4 years ago. They work with our external clients. They do rebate modeling to help our external clients build lowest net cost formularies for their members. I also lead the point of sale rebate operations team. So that's where you pass through formulary rebates at the point of sale where members are picking up their prescriptions to help lower the cost to the member and make the drug more affordable. And then finally, I lead Innovative Strategic Agreements, which is value-based contracting. So the healthcare system is really moving from volume to value. It's transformational movement away from fee-for-service to contracting based on outcomes. And that's what I do, but I do it in the pharmacy space. So my team works with pharmaceutical manufacturers to develop outcomes-based contracts. So instead of paying per pill, we're really paying based on the value that a drug delivers. And the reason this type of contracting is so important is there's quite a few gene therapies on the horizon that are in development, and they will likely cost about $2 to $4 million for a one-time therapy. So we really want to have these contracts in place that would allow a payer to be refunded for that cost of the drug if the drug doesn't work.
So extend that point a bit more, and it's an interesting element that you have a sense of what these underlying costs are, but what are some of the practical applications of business decision, and how did what you learned in the School of Public Health help you better understand how you would make these matches of market realities, corresponding with the costs that are inherent in high cost and high technology healthcare?
So I think one of the main points that I use every day is around prevalence of disease, right? Because there's a finite bucket of money that is available to pay for healthcare. And so if you're having this, what we like to call a tsunami of gene therapies on the horizon that are going to cost millions and millions of dollars, you have to make room in that bucket for these therapies to be paid for. So how do you make that room? And I think that innovative contracting is a way to do that when you're only, you have so many people that are on statin drugs, but those are low cost. So you can afford for some people to fail those and not recoup that money. But you can't afford for people, even though the prevalence of these diseases is low, the cost is so high. And so when you look at the total cost of care, you have to make sure that there's accountability that those drugs are delivering the value that you expect them to.
All right. I definitely appreciate that, the bucket perspective and a crowd out effect. But here's something that perhaps, we couldn't have directly and definitely in terms of the timely perspective, the COVID-19 pandemic. How has the pandemic impacted your role and the way that you and your organization engage this challenge in order to be able to create value in your own organization?
Yeah, so it's been difficult because I normally travel a couple times a month at least. I go to conferences. Those are great places to get quick work done when you're just meeting in hallways. And so there's been none of that. And we've had to all have the challenges of working from home and meeting remotely like this. But I think the biggest impact to my job is actually going to be the delay in clinical trials, which means a delay in approval of therapies for people that need it. Because, the companies trying to get them off phase 2 and phase 3 trials, they've been pushed out about 6 months, which means, those approvals are going to be pushed out at least that long as well.
So the crowd out applies here as well, that the trials and the actions that we have in having access to a sufficient population is impacting that. Let me transition a bit here and thinking in terms of your life and your career and your development. Do you have a mentor? And what aspects of mentoring do you find most important in your life and your career?
I do have a mentor. That was one of the first things I did when I came to Optum, was seek out somebody that could mentor me. And her name's Carrie Tanner, and she's been really great. She's mentored me personally and professionally and helped me become a better leader. And I didn't even know how good of a mentor match I picked, but I started the process to donate a kidney to my dad. And at the same time, she was starting the process to become a non-directed donor. And so she ended up donating a kidney about 6 months before me. And she even mentored me on how to donate a kidney. So, how much better of a match can you pick than that? So she's been really great. And I think I try to pay it forward with mentoring as well. I was very fortunate to be selected for an executive development program here at Optum. And so when I graduated from that, they asked for mentors to help mentor the up and coming people in the program. And I do that every quarter or every year when they bring in new cohorts. And then we recently I was asked to mentor some interns through their final project. And so I did that as well. So I think mentoring is just, the ultimate way to give back to people and pay it forward what's been given to you.
Outstanding. What is your ideal job? And as you envision that ideal job, are you in it now? And where do you see yourself 10 years from now as an advanced alumnus of this school?
So I definitely love what I'm doing. I think it's interesting and engaging. If I could move and take this job and move it a step forward, I would love to work in government like HHS or CMS, where policy and regulations are actually being made. That's definitely one of the challenges that we run into in trying to be innovative, is policy and regulations not taking into account that innovation. So I think the key to opening the door in innovation is addressing those policy and regulations, which I try to do for my current position, but I think, actually being a decision maker and knowing what it's like on the other side would just be so valuable. And then I'd also love to teach. I'd love to come back to UofL and work in the School of Public Health.
All right. Well, whether or not it's a guest appearance or something on a more permanent basis, I am certain that you have all of the development and all of the experience. And so I'm sure there will be a place here at your University of Louisville home for that. So we'll keep you in mind. Now, to that point, though, and this sort of dovetails with having people who are competent and creating great value in practice, but also from a research perspective, what was the most valuable aspect of your University of Louisville experience as it relates to your development, but also the ability to work and to network and to have an effect to create value in population health management in communities?
I really appreciated all of the guest speakers that were brought in to speak in classes. I think that was a great way to network and meet people in the community that you would never cross paths with. That to me was very valuable. And I would say that I wish I wish I had more realization when I was there to, as soon as you meet someone, like connect with them on LinkedIn. I think those connections are so important, and you never know when you're going to cross paths again, or when you might need to reach out to somebody for their expertise. So I really appreciate it. And almost every class, it seemed like they were, the professors were using their networking experience to bring in somebody to share their expertise. And that really, I think that, when you're in school, you just don't realize how great that is and how valuable.
All right. Well, I'm going to ask you to put somewhat of a futurist lens on. Based on your life and career experiences, your time in our programs at the University of Louisville and work there at Optum and a member of the field, where do you see potential innovations in public health and population health management? How can we make real meaningful evolutions, or do you see a revolution on the horizon? And then from that point, and thinking about future alumni, what roles or jobs or positions do you see that fit in that future of innovation and evolutions?
I think that collaboration is definitely going to be the key to driving public health forward. I think that public health is severely underfunded, but there's so much opportunity now by partnering with big health plans like Humana and Optum and places that have a lot of money and also have a lot of data. And so being able to partner and collaborate and use the public health knowledge along with the data and the money, I think that's really going to kind of drive us forward and we'll see great strides in healthcare.
So what roles or positions do you see new combinations of competencies or positions that future alumni of the School of Public Health would have in order to be able to meet this new reality of collaboration, innovation, and resource utilization?
I think people that are able to see things from a public health side, but also have experience with analytics and data, artificial intelligence. How do you mine through all the data we have and utilize that? I think that would be such a great skill set to have in public health today, because being able to understand the business side, but also the tech side to move it forward, I think that would be great.
Do you have a sense that these are skills that employers are seeking? Greater analysis on health data analytics, management administration, informatics? All right.
Oh, definitely. Yes.
Would you see the next 3 to 5 years? Clearly, we here are in 2020 in the midst of a pandemic. This pandemic follows what is a new normal state of healthcare. But where do you see challenges and opportunities to enhance population health management in the next 3 to 5 years coming out of this pandemic?
I think there's obviously a ton of lessons learned and how we responded and how quickly we responded. I think there's going to be a lot of discussion on whether states should be able to individually make decisions, or should be things, in this situation, should it be more of a national response and less of a state response? Because we definitely see how different states responded and how different states had outbreaks and different states didn't. Were resources allocated appropriately to where they needed to be? So, hopefully in 3 to 5 years, we've taken the lessons learned so that when the next pandemic happens, we have a better response and it's faster, and we don't see disproportionate deaths like we've seen during this one.
Have you seen and observed, how we may have already started some of these evolutions, any innovations that how your own organization or the field has tried to adapt since January, February to enhance the way that we respond, perhaps fundamentally enhance the way we coordinate and deliver healthcare?
Yeah, there's a lot of work that I've seen that's being done in Optum, a lot of work with the data, a lot of research, just internal, just taking data points that we've seen how we've seen deaths in different populations as opposed to other populations, and why, and how can we address that, and how can we deliver healthcare, and telehealth, you know, taking advantage of telehealth, and how do we propel that forward and keep that in the forefront, because I think one of the best things that has come out is really that people embracing telehealth, and it's so important, especially like in behavioral health and how that can be utilized, and there's been loosening of restrictions with that, and I think that, you know, all of managed care has really told the government, hey, I think this is great, this is working, let's think about keeping these restrictions loose going forward, and so that might be a big change that comes out of this.
Okay. As I see, we still have a bit of time left here. I want to remind our folks, and Angela, if you see any questions from the field, from our audience, if they have questions for Dr. Forristal, I'm happy to incorporate. Dr. Forristal, I'll extend that point about telehealth. Do you see that the developments in telehealth as it relates to care coordination, or perhaps in a more preventative way, could be a new, a more meaningful component of a business case for how we manage population health going forward? Or is it still too early?
Definitely. I think that we can definitely utilize that, especially, I mean, if you think about rural areas that, you know, are lacking in the physicians that they need to treat the population, telehealth could be a way to bridge that gap. So I definitely see it as something that's already making a big difference that I think can be maybe even better.
You know, a big point of discussion among at least the political parties in this season of politics and evolutions of the way that we consider healthcare as a right or healthcare as a privilege, it really boils down to either one, improving or enhancing the state of the Patient Protection and Affordable Care Act, and then of course there are all the reforms going even back to Medicare and Medicaid inception in the 1960s. Looking forward, do you see opportunities for the way that we finance care to be enhanced, to bring these components of our system of systems closer together to achieve higher quality care, better access, and better outcomes?
So when I was going through the program, I worked at Humana, so big Medicare, and now moving to Optum, I've gotten to learn more about the commercial side. And I've always been a huge proponent of Medicare Advantage. I think that when the ACA was developed, I was a little disappointed that they didn't use Medicare Advantage more as you know, kind of how it should have been. And so Medicare Advantage is great because it's funded by the government, but there's still choice, and there's still different levels of access. And so I think it takes the best of both worlds and puts them together. And I think that there's a lot to learn from Medicare Advantage. And now we're starting to see, the differences in people that have straight Medicare versus have Medicare Advantage. And there's some definitely health benefits there as well. Their people are healthier, their health is managed better. So, I think that it's a little scary to think about maybe government run healthcare, and especially, what would my job look like? But I definitely think there could be some benefits there to look at, something like that.
Sure, and I started to add the underlying component within the United States of America and its inherent range of individualism, libertism, but yes, also a common community spirit of belonging. And so in that same vein of our positively, peculiarly unique system in some ways, do you have a sense that potential changes to the Supreme Court in terms of the composition and transitions of justices may impact your role in the way that organizations, for-profit organizations, may coordinate and deliver healthcare in our country?
Oh, definitely.
Potential legal interpretations.
yeah, I mean, definitely like, not just the Supreme Court and also the election, those all, it doesn't matter, Democrat, Republican, liberal, conservative, whoever gets in, they're going to impact healthcare in some way. Healthcare is a hot topic. It's something that they're going to want to address. And so we're always, very in tune with what's going on in Washington and what regulations are being passed and how that will affect our operations and our day-to-day and how we need to adjust. And so we're constantly making adjustments, whether it's ACA or, Trump's rules about point of sale discounts and Medicare. We're really agnostic to party lines. It's definitely going to affect us in some way, no matter who gets in.
All right, well, thank you. I'm going to transition in another route, ask you a bit about national political policy, judicial perspectives, and how we might enhance healthcare. But you, Jennifer Forristal, a human being on this planet Earth, a member of our community and our society, it's not all work and all play. Tell me about your family and your role with maintaining good work-life balance, and also your thoughts and your view and participation in community service and how it fits a role in your life.
I'm married. I have 2 kids. They're both teenagers in high school. My parents live here as well. In fact, I'm in their house 2 doors basically down from my house because they don't have dogs and kids in their house. It's much quieter. And my siblings also live here as well. So we're originally from Pittsburgh, but we've lived in Louisville for a long time. So this is home for all of us now, and it's really great. And we all definitely try to give back. I was raised, having a community mind. My dad's a pastor, and it seemed like we were always doing some type of community service. So I try to do that with my children as well. There's an organization called Fed with Faith. And pre-COVID, you could go and you could make meals and package them up, and they take them out and meet the homeless where they are and deliver those meals. And it was just great because it's something that you can get your kids involved and they could help as well. And they can see that, the good that you've just giving a few hours can do. I also look for little ways to volunteer. There's a app that you can download. It's called Be My Eyes. And it's for blind people that can download it, and they maybe don't want to inconvenience their friends and family. So they go to this app and they can call someone. And we've had calls that are like, hey, is this beef or chicken? What should I cook this at? What does it say? $3.50? Just a little things that out of it, like just 2 minutes out of your day that are a huge help to someone else. And so now my husband, we like to fight to see who gets more calls on the app because we like to, it's just fun to help somebody out. So even just looking for little ways in the day to help someone else I think it makes me very happy.
All right. Well, we're almost out of time. Just have a couple more questions. Working your way to the end, what do you think the one best idea from in your role and in your experience and your development, what's our one best idea for improving public health in the United States of America?
Oh gosh, the one best idea. I personally, might be a little too much information, but so my friend Robin and I, when we were students, abortion is a very hot topic for everyone, right? And we would always have discussions about that. So she really helped me to see that prevention of the need of abortion is really the key to whether you're pro-abortion or pro-life or whatever, pro-choice, pro-life. Preventing the need for abortion is really the key. So free birth control, to me, that would be, and I think the ACA tried to do it. I don't know that they necessarily got there, but you can go get free condoms anywhere, but free birth control is a little bit more difficult. So I think that would help public health tremendously. And I think, maybe it would help calm the debate a little bit as well.
Well, thinking about the perspective, and to close this session in terms of for questions, think of the perspective of our students, the current students and our graduate, undergraduate, for that matter, and the doctoral students. What advice do you have for them? You know, as they are in these courses, whether it's pandemic, coronavirus, hybrid, online distributed learning, or the way forward, what options do you see before them? What are some key life and career considerations? And what's something that you can leave with them that allows them to be able to create value as you have in your life and your career?
So I would say the first thing is to network with your peers in your class, with your professors, with your guest lecturers. If you don't have a LinkedIn account, make one. And network with everyone that you meet, because you're building relationships, and those relationships are really going to help you advance your career. Find a mentor, find somebody that you respect, someone that they are doing something maybe you want to do, someone who will advocate for you. I think that's so important. And then find an internship. I mean, that's the best way to get experience, especially if you don't know what you want to do. You're either going to love it or you're going to hate it, but you're going to learn what you like to do and what you don't like to do, and keep an open mind. I mean, when I was an undergrad, there's no way I would have thought I would fall into this. I didn't even know this job existed. So you never know where your career is going to take you. And if you're in a job and you're not happy, learn from it, because you're going to be able to use what you learn in that job in your next role, and you're just going to continue to grow. And eventually you're going to end up where you want to be.
All right. Well, and I can't help but at one point, and sort of incorporating some of what you shared with us today, maybe just as you're giving this advice to these students in this interview and in life in general as a mentor, we may very well see you in the classroom, either soon as a guest lecturer or potentially joining our faculty team. So thank you very much. That closes the questions that we have for this formal session.
Okay. Thanks, Dr. Bewley. I'm just checking in with you here. Did that cover all? I don't think we've covered all the questions in the chat. So I wanted to read maybe the latest one from Dr. Blakely. He says, we know that you already serve as a great mentor and resource to some of our students. Do you have any thoughts about how the school should chart a different course in engaging alumni in our primary teaching mission? Did we cover that? Or
I don't. So how to engage alumni. And I think, I mean, personally, in fact, I think an email went out from the School of Law accidentally to me anyway, asking for mentors. And you don't want me to mentor law students, but I definitely think that would be a great program for the School of Public Health, is to reach out to alumni to get mentors and match them up. I would love to mentor people in the School of Public Health. I think it would be great.
Well, that's great. I also got that email, but not the law degree to go with it. So we all live and learn. Technology is our friend, and sometimes not so much. So that's great. Let's see if we don't have anything else in the chat. I guess I am just here to thank everyone for joining us. Thank you again, Dr. Forristal, for joining us in this virtual format and being open to doing it this way. Of course, we would have rather have had something in person, and hopefully we can do something in the future time with you. Anyone who's joined us today, you'll receive an email for feedback from the Alumni Association. And we'd love to hear from you, so that if there's other ways you'd like to connect, ideas you'd like to submit for future events, or just ways that you want to be engaged more with the school in our primary teaching role, in a mentorship role, in any other way, you can communicate through that survey. Dr. Bewley, Dr. Forristal, do you have any other parting message or words you'd like to leave us with?
I'll leave the last word to Dr. Forristal. Let me just say it was a pleasure spending time with you today. Jennifer, you are a great colleague, an outstanding alumnus, and we are growing and developing our School of Public Health and Information Sciences to grow more alumni that follow the path that you have. So thank you very much for your time. It was a pleasure to spend this afternoon with you.
Thank you. Thank you, Dr. Bewley, and thank you everyone for having me here. And I'm so humbled and honored to have been chosen. And especially my class, Susan's on here, I know, but the people I went to school with, I don't think I'm any smarter than them or any more accomplished. And so I'm just so honored to have been chosen. I was surrounded by the best, and so thank you.
Thank you. Thank you so much for sharing all that information with us, and congratulations again. I guess we can leave for Kelsey with the Alumni Association to have a few wrap-up moments and tell us what comes next.
Sure. Well, everyone, thank you. Great job. I'm going to go ahead and stop streaming on Facebook, and I'm also going to end